More than 29 million people here in the United States have diabetes, and more than twice that many are considered pre-diabetic. Doctors now say the best way to care for those pre-diabetic patients is changing. Our Health Beat anchor Anne-Marie Tiernan's in studio today with what you need to know. Hi, Anne.
Well, hey there, Scott. Pre-diabetes, certainly a wake-up call that you could be on the path to diabetes, but the good news is it's not too late to turn things around. Dr. Steve Samuels, a doctor with St. Francis, joins us today. And Steve, thanks for joining us today.
Thank you for having me.
Dr. Samuels, you see this in your office every day, don't you?
Absolutely. Pre-diabetes is about twice as common as diabetes, and we now know that treating it early is a benefit to our patients.
So the first thing that you say to people when they're pre-diabetic is this whole message about diet and exercise, right?
It is the best way. If you can lose weight, exercise, follow a diabetic type diet, that's the best way to treat the diabetes. It decreases the workload on the pancreas, and it can actually prevent you from proceeding on to diabetes.
So we're talking about weight control. You want to lose as much as 5 to 10% of your weight?
Of your body weight, yes.
All right. And then exercise, are we talking about aerobic or moderate exercise?
Aerobic's the best. 30 minutes 5 times a week is what's been shown to be enough to actually have a significant benefit for you.
And then the changes in the diet?
Yes, going to a more of a high protein, high fat, low sugar diet, especially the concentrated sugars.
Okay, but you find day in and day out that these recommendations about weight control, exercise, and nutrition, patients are failing on this.
We wish they worked better, but only about 5% of patients truly follow these recommendations, lose the weight, start an exercise program, and control their pre-diabetic state that way. So the next step is to move on to medications.
And so tell us, why is medication early in that pre-diabetic stage so important?
That's the new findings. We can actually keep you in the pre-diabetic state longer so you don't actually develop diabetes by starting medications earlier. Unfortunately, doctors and patients just aren't doing that yet.
And what are the drugs that you would recommend for that?
The first line drug that we also use for diabetes is what we also recommend in pre-diabetes, metformin. It's been around for years. It's very safe, low side effect profile, very inexpensive, and works very well to extend that pre-diabetic state so you don't actually go on to develop diabetes.
And I understand there's also a newer class of drugs out there that help you eliminate the glucose in your system.
Yeah, one of the newest classes. Yeah, one of the newest classes is called SGLT2 inhibitors, and they actually make you excrete the sugar in your urine, therefore getting rid of actual calories into your urine, up to 350 calories a day. When there's 3,500 calories in a pound of fat, that's a lot of sugar. That's this much sugar in one day you can excrete by taking this pill on a daily basis.
And real quickly, there is another group of drugs that there's concerns about risk of heart issues.
Very commonly second-line used drugs called DPP-4 inhibitors. They've been around for a long time. Januvia and Onglyza are the two that we're a little bit worried about. Some recent studies have shown that they may exacerbate heart failure in patients with known heart disease. And so if you have diabetes and you also have a diagnosis of heart disease or heart failure, you may want to talk with your doctor about that.
All right, very good. Thank you very much, Dr. Steve Samuels, for joining us today.